February is Heart Disease Prevention Month, and a whole lot of experts agree that a well-chosen plant-based diet is the #1 preventer of this #1 killer, and the only way that's been shown to actually reverse coronary disease. And today, we're going to learn all about that. Hi, everybody. I'm Victoria Moran. What a pleasure to have you with us on the Main Street Vegan program. And I just am so grateful to all of my listeners. I love it when we meet up at Veg Fest and things like that, which are all going to start happening again. I'm so excited. And if you would like to get better acquainted, we have a group on Facebook, the Main Street Vegan Podcast Listeners Group, and that's a way that you can have some input into what happens on this program and a little bit of insights. And sometimes I'll put in kind of a director's cut, things that I heard from our wonderful guests that maybe didn't make it onto the show. So that's a fun place to be. Main Street Vegan Podcast Listeners Group. Hope you'll be part of that. Well, I promised you a heart savvy guest. And I do have one of the top experts in America on both heart disease and wellness in general. And he is Baxter Montgomery, MD, a board certified cardiologist, clinical assistant professor of medicine at the University of Texas at Houston. He's a fellow of the American College of Cardiology and founder and medical director of the Mongomery Heart and Wellness Health Center in Houston, which he founded way back in 1997. He's also the author of The Food Prescription for Better Health, which you can find on Amazon. Welcome, Dr. Montgomery.
Thank you very much. Thanks for having me, and thanks for that wonderful introduction.
Well, it's a pleasure to have you here. I've wanted to have you for so long, and I think our paths kind of crossed and uncrossed, and you're very busy. So this is the perfect time. This is the perfect February
Yes.
to welcome you to the program. So, we talked a lot in the introduction. You're a cardiologist, you're a professor of cardiology, and everybody knows that's a heart doctor, but it's curious to me that in the plant-based world, when we think about, the people who have shown that a plant-based diet can reverse heart disease, Dr. Ornish, Dr. Esselstyn, neither one of them is a cardiologist. So tell us about cardiology and why we should know about that specialty.
It's a great question. Cardiology, and as we often refer to cardiovascular disease, deals with the heart and blood vessels. So essentially it deals with abnormalities or disease of the heart and blood vessels. And so it's a broad area that's covered. And in fact, the area of cardiovascular disease has many sub areas. For instance, my specific training and subspecialty was not only general cardiology. Of course, every cardiologist starts off with internal medicine. So we train and manage disease of the entire body. Then we go do a specialty training, which is our subspecialty training, because internal medicine is our specialty training. The subspecialty training is cardiology, cardiovascular diseases, and then we may go into different areas. I'm a cardiac electrophysiologist, so deals with electrical disorders of the heart, in addition to some broad areas. There are other areas such as heart failure, structural heart disease, that deal with valvular disorders. And then some cardiologists may do more with the vascular structures than they would with the main heart. So it's a broad area that deals with diseases of the cardiovascular system. And then there are sub areas that many of us will focus on, in addition to covering the general cardiology area. So my subspecialty area was electrophysiology, which deals with electrical disorders of the heart. We deal with individuals with sudden cardiac arrest or arrhythmias, like both Parkinson-White or atrial fibrillation. There may be other cardiologists that may focus on areas such as structural heart disease, which they may do valve replacements using catheters. Others deal with vascular structure diseases such as peripheral vascular disease, the carotids or lower extremity arteries. And then there are cardiologists that may focus on areas that are diagnostic, primarily in nature, in addition to general cardiologists such as nuclear medicine, cardiac MRI, and these other areas. And then, of course, there are heart failure specialists that deals with patients with advanced heart failure who may need transplants, who may need left ventricular assist devices. They're managing those patients who are at the tip of that area. So all of us cover the broad scope of cardiovascular disease, and then many of us will have areas that we will, focus on with patients with, severe disorders in those areas. And mine is electrical plus heart failure as well.
So I think for lay people who eat plant exclusive diets, we just kind of generally say, oh yeah, we eat in a way that's really good for our hearts. We eat in a way that prevents heart disease. But you've described so many different areas. So help us understand, what kinds of heart disease are we preventing this Heart Disease Prevention Month by eating a well-chosen whole food plant-based diet?
Well, that's a great question, because what I'll say is, and I'll even go, farther back into my internal medicine perspective, because it's not only if you're eating a healthy diet, I'm gonna broad label as a healthy diet, then you're improving your chances against, any disease, because cardiovascular disease is an outward manifestation of an underlying process that I like to describe as biochemical imbalances and physiological imbalances. So if you have, things that contribute to biological or biochemical or physiological imbalances, then you have a chance of manifesting one of a number of types of disease. Cardiovascular disease is one of those categories. You can have an endocrinological disease. You can have, a malignant disease or an inflammatory disease. So your manifestation of a particular disease type or particular disease types depends on your overall lifestyle. And the worse your lifestyle is, including your eating lifestyle, the more likely you're going to manifest your genetic predisposition to one or more disease states. The healthier your overall lifestyle, especially eating lifestyle, the less you're likely to manifest your underlying genetic predisposition to one or more disease states, and the more likely you are to live a healthy, disease-free life. So to answer your question about, preventing heart disease, you're really giving yourself a chance to prevent all areas of heart disease, whether it's coronary disease that deals with blockage of plaque in the arteries in the heart, or vascular disease, peripheral vascular disease deals with blockage of plaque in the arteries in the peripheries, such as the neck and the carotids, the lower extremities, or heart failure, which is a structural problem, valvular disease. So you're really sort of collectively preventing all of those if you're maintaining an overall healthy lifestyle, particularly a healthy nutritional lifestyle.
So some people, I had put out a little bit on social media that you were going to be coming on, and people were asking about atrial fibrillation. I think there are lots of TV commercials about that now, and all of a sudden it's something that people are thinking about and maybe worried about. So what's that, and does diet have anything to do with it?
That's a great question. So atrial fibrillation is an abnormality of an electrical abnormality of the upper chambers. It's I will say the most common arrhythmia that we deal with in cardiology and electrophysiology in general. And essentially what it is a situation where your electrical system is in disarray. Normally, the normal electrical system consists of your God-given pacemaker, which starts in the sinus node, and it sends electrical signals to both upper chambers. We call them the atria, the right and left atrium. And it also then sends that electrical signal then to the lower chambers, which are the ventricles. So a normal electrical conduction system allows for normal electrical signaling through the heart, which allows for organized contraction of the heart. You get the upper chambers contract first, the lower chambers contract second, and you have orderly flow through the chambers of the heart. When the electrical system is in disarray, it can impair the normal mechanical flow. So atrial fibrillation is a condition where the electrical signal through the atria, instead of being a normal conduction, organized conduction through the atrium, the conduction becomes in disarray. And so you don't have one electrical circuit going through, but you have infinitely many electrical circuits that are firing in different locations, and they are randomly sending electrical signals to the lower chamber in a disorganized, rapid way. So what happens is that instead of the atria, the upper chamber is contracting like this in an organized fashion, they're just fibrillating. And so when they're fibrillating, the blood inside is just sloshing around and randomly moving across. So that predisposes to clot formation. And that also predisposed to impaired circulation, because if you have fibrillating upper chambers, the flow from the upper to the lower chamber is impaired. So therefore, the flow overall through the heart and out of the heart is impaired as well. So your total circulation or flow from the heart is impaired. So your total, what we call cardiac output, or total circulation through the body, can be impaired with atrial fibrillation. So you have a circulatory impairment when the atria are fibrillating. Then you have a formation of clot, potentially, that predisposed to stroke, or predisposed to some clot embolizing to the heart, causing a heart attack, or some other part of the body. So, so atrial fibrillation is an abnormal heart condition, abnormal electrical condition in the upper chambers that impaired circulation through abnormal flow from the upper chambers to the lower chambers, and it predisposed to clot formation. And it's a rhythm disorder that we like to get under control to allow the heart to contract normally.
I see. And you also mentioned heart failure. And I think a lot of people have had elders in their families leave this earth with that condition. So can you describe that one?
Yeah, heart failure, and the classic definition of heart failure, well, there are many classic definitions, or many ways to describe it. The way I like to describe it is the inability of the heart to circulate blood commensurate to the body's needs. So for instance, we have one form of heart failure that we call systolic heart failure, when the heart is weak, so it doesn't contract normally. And when I say weak, we're referring to the lower chambers, particularly the left ventricle, because that sends blood to the total systemic part of the body. So when we talk about low ejection fraction, or low EF, many of your listeners may be familiar with that terminology and phraseology. We're talking about the left chamber, or left lower chamber, the left ventricle. So essentially what happens is that the normal ejection fraction, which is the percentage of blood that the heart ejects with each contraction, the normal ejection fraction is around 55 to 65%, at least no lower than 50%. And so if it's below that, or at least below 45%, then we call that systolic heart failure. That means the heart is weak and it's not contracting normally. But there's another form of heart failure when the heart doesn't relax normally. So the heart can be weak, or the heart can be stiff, or it can be weak and stiff. So the stiff heart that contracts normally, we call that diastolic heart failure. And so a stiff heart doesn't fill and allow enough fluid in. So if you think of a stiff heart as a very thick wall balloon. So if you go to a party shop and get a regular balloon, you inflate it with your mouth, you can probably blow it up easily. But let's say you go to a tire shop and they make a special balloon using tire inner tube, and you try to inflate that with a very thick rubber, you'd have a hard time inflating that. That's diastolic heart failure, because that's this stiff and it requires more pressure and less filling. So in summary, a weak heart will not eject enough blood out for your body's need. A stiff heart will not allow enough blood to fill to be ejected out for your body's needs. And you can have a combination, a stiff heart and a weak heart, where you don't eject enough or fill enough. So heart failure, again, is the inadequate ability of the heart to send blood to your body's needs. So if you try to climb stairs and you need circulation of, say, 5 liters per minute, and your heart can only circulate as fast as 2 liters per minute, then you're not going to be able to climb stairs as fast as you normally are able to, because you can't circulate your blood fast enough for your lower extremities to work effectively, your lungs to work effectively, et cetera. So you may take a longer period of time to climb those stairs. If you need to walk a block and you need to get your circulation up to 4 liters a minute to walk a block, and you can only get it up to 3 liters a minute, then it's going to take you longer to walk a block, or you may have to stop part of the way. So the symptoms of heart failure vary, and those are some common symptoms of fatigue and inability to exert yourself. But the inability to circulate blood, it can become so extreme that you don't circulate blood adequately to your kidneys, to your liver, to your brain, to your GI tract, and other organs. So heart failure people in advanced stages can have symptoms of GI discomfort or indigestion, because they're not able to perfuse their GI system, so they're not able to absorb their food and digest their food or their medications. They're not able to circulate to the kidney, so they may retain more sodium and retain more fluid. That creates swelling and edema. They're not able to circulate blood fast enough to relieve congestion from the liver. So they start to develop liver failure. So heart failure can have a multi-organ dysfunction appearance in addition to just symptoms of shortness of breath. And not to mention, if you're not circulating to your brain adequately, you can start to have, brain fog and some mental clarity problems with heart failure as well.
Wow. And it's complicated, I think, for the layperson, because some of those symptoms that you talked about also seem to be the symptoms of the coronary and vascular kind of heart disease, shortness of breath and that kind of thing.
And that's correct. And the thing is that people don't come in with isolated problems. So when I see a patient with heart failure, they also have arthritis, inflammatory disease. They may have, primary liver congestion and dysfunction due to the many medications they're on or the food they're taking in. And they may have primary kidney problems due to other problems like hypertension and diabetes, in addition to the heart failure, and brain problems may be due to circulatory problems in addition to heart failure. So you're dealing with a myriad of problems in patients coming with multi-organ dysfunction, and many of them are on multiple medications because we're treating the symptoms of them. And so polypharmacy is a disease in and of itself. So that's why we like to use, when I see patients like this, we like to use an approach that utilizes an acute nutritional detox. What that does is that it treats the body systemically, and it treats the body in a multi-organ fashion. So now we're treating a heart failure, we're treating liver dysfunction, kidney dysfunction, et cetera. And we're allowing ourselves to wean the medications because they're not having to, for instance, if the cholesterol is better on a better diet, then they can come off the cholesterol medicine, which may be impairing the liver, which, may be impaired because of the heart failure, et cetera, et cetera.
I love that term, acute nutritional detox. So you're not just talking about, well, let's eat better and be healthier as a general kind of thing. We're talking food as medicine, you and Hippocrates.
That's exactly right. In fact, we've had publications, and I'm actually getting ready to enroll patients for another study. And we're looking at patients with coronary disease, or history of coronary disease, where we're going to actually look at a nutritional intervention and look at the biochemical effects as well as the clinical effects, which we've done. We have publication look at some of the biochemical effects. We're going to look at more in-depth intracellular mechanism. We're teaming up with a biochemistry lab, a nutritional biochemistry lab at Georgia State University. And we'll be kicking off that study very soon. I'm excited about the potential indications of findings that we look forward to seeing. We'll be comparing our intervention to the Mediterranean diet, which is going to be a great control source. But to the point that you made, acute nutrition intervention, what I'd like to do is describe our regimen. It's not a matter of putting people on a diet, quote unquote. Mm-hmm. Our approach is the manipulation of food such that we try to bring about a certain biochemical and physiological outcome in someone who's acutely ill. And it's slightly different than saying, okay, eat a vegan diet or eat a whatever diet or plant-based diet. Those are healthy diets. But sometimes the food often is raw. We may use intermittent fasting or time-restricted eating, and a whole host of things that we will utilize in addition to targeted micronutrient supplementation and the like.
Oh, that's exciting stuff. So somebody comes into you and they're having some of these symptoms, and you have determined that there's maybe something wrong with their heart, something wrong in some other places. What does the food look like? Just talk us through the day.
Yeah, so what we do first and foremost, and it depends on where they are in terms of their food knowledge. So we have people of the whole spectrum. Some people are already on a plant-based diet and may need to manipulate things more. But what we do first and foremost is discern where they are with the medication, what the diet is like, what their diagnosis. So for instance, if someone who's a diabetic with heart disease, et cetera, they may be on a high dose of insulin or something along those lines. Typically, we'll start them on a raw nutritional detox that consists of lots of salads. We use green smoothies, which predominantly greens in them. There is some fruit in the smoothies. We use a gourmet raw regimen. So we may have dehydrated foods that are warmed up to 130 degrees. We have a sprouted rice dish with herbs and seasonings. We make a number of wraps and breads, and we have our own nutrition center and restaurant on site. So we make all of the food from scratch. We make our breads and other things from scratch. And we found that we had to do that a long time ago in order to really know what's going in our patients' systems. So a lot of it consists of dark leafy greens and a lot of other vegetables, raw broccoli and other cruciferous vegetables, carrots, beets, the whole run of things. And what we do is we manipulate these foods and they're in salads, wraps, and various other dishes. And we make gourmet raw dishes. We have a pizza, for instance. We have a beet burger sandwich. We have a Hulk burger sandwich, which is a patty made of lots of greens. We have tahini wraps, which the tahini is made of raw coconut meat with psyllium husk and bell peppers. And so that's a wrap. It has a nice texture, and we add, we wrap it in sprouts. We've recently converted our kitchen to local, sustainably and organically grown produce, which we've emphasized is a very important thing. We make for instance, the beverages consist of maybe coconut water, or we make a superfood water that consists of filtered water mixed with some cold pressed ginger, a blue green algae, and some other super greens that's mixed with it as a hydrating source. So there are a variety of things that we integrate in with our patients. We have some raw vegan pecan pie and some other similar desserts. So there's a whole host of things that we implement, and a lot of that's done. The gourmet part helps with sustainability of the nutritional regimen, because when you say raw detox and people say, well, okay, lettuce and tomatoes or whatever the case is, I can't do that. We have an integrated care clinic where patients will come into our clinic in addition to maybe getting some cardiac testing or results reviewed, et cetera. That clinic on a certain day of the week is where we sample food with our patients. We go over the nutritional regimen in addition to other interventional modalities.
Wow. So most of the plant-based cardiologists that I've had on the program don't talk much about raw food. You cook it, you eat it raw, it doesn't matter as long as it's plants and you're not using a lot of salad dressing and stuff like that, then that's good to go. So tell me about the benefits of more raw food and why this is so helpful.
Raw food reduces oxidative stress and inflammation, in my opinion, at a faster rate than cooked foods. There was some data that Jenkins had published, and we referenced it in one of our publications, where he actually compared a raw diet. Now, this is over a 3-week period of time, but in the acute setting, you want to look at the rapid effects of the food. And so when you're looking at reduction of inflammatory markers, so like in one of our publications, we saw a reduction of a cytokine, IL-6, was reduced by 22% in just 4 weeks. C-reactive protein is an inflammatory marker, reduced by 30% in just 4 weeks. And we know that we're seeing a weekly change in these things. We've done spot tests, and our next publication will actually demonstrate a weekly change in these inflammatory markers. And so you get very acute changes in acute inflammatory conditions. So for instance, I had a heart failure patient in the hospital, and she had a valvular dysfunction and a number of other things going on. I talked to one of my colleagues and recommended she get a mitral valve clip, and he said, well, she's too far gone, and we should just go with comfort care. And another colleague that does my electrical work interventions, she didn't want to intervene, so she was on a heart failure medicine called milrinone. We tend to give it to advanced heart failure patients alike. So there was they were trying to get her out to hospice and out of the hospital. So the hospice team came and talked to her, and she was, a little bit distraught about her condition. So I'll tell you what, look, we're going to detox you and we're going to get you better. And so we put on a raw detox. I put on strictly smoothies with super greens and certain things. We brought it from our restaurant and we custom made it. And so we weaned her off the milrinone drip in about 5 or 6 days. Her blood pressure improved, urine out improved, and urine output improved, and she left the hospital. She actually got much better within the first few weeks of being out of the hospital. The point is that raw detox intervention, that change could not have occurred had I just given her regular vegan cooked food. No, she would have been in bad shape. She would have died right then and there. Rob made the difference. And there are many other situations where we've done that. So what difference does it make? It's a faster way of reducing inflammation. It's a faster way of reducing oxidative stress. And it's a better way of improving someone's condition if they're acutely ill in the hospital. There's clearly a difference there. I've had a patient on a ventilator once, and we detox it with raw food through a PEG tube. Again, it reduces inflammation, reduces oxidative stress in a very rapid way, and it helps inflammation, cytokine storms reverse in someone who's acutely ill.
Wow, that is really exciting. You make me want to go make a smoothie during the break. But I'll probably talk to you during the break. That will be even more fun. And when we get back, I want to talk about inflammation. This is something that we hear that's connected with all sorts of disease processes. And I think most of us don't really understand what it is or how to deal with it. So everybody, just stay with us through these messages from the good people at Unity Online Radio. Get yourself a little dose of inspiration. That's probably pretty healing too. And we will be back with more with Dr. Baxter Montgomery. And you can find him on at MontgomeryHeart.com right there on your computer. See you soon. Welcome back, everybody. Now, it may have sounded odd to you when I said see you after the break, because chances are you're listening to this as a podcast, which we have been doing for very nearly 10 years. So you're either listening more than likely on Unity Online Radio or on one of the podcast apps. But these days, we're actually also doing this in video format and putting it on YouTube, on my YouTube channel, Victoria Moran NYC. So if you ever want to see what we look like and feel like you're a little bit more visually engaged with the Main Street Vegan podcast, you can join us on YouTube, and that would be cool too. So a couple of announcements of things that are going on in the world of Main Street Vegan. You know that Main Street Vegan Academy is just the coolest place where you can come now online, so you don't have to go very far, and get yourself certified as a vegan lifestyle coach and educator. This program has also been operative for 10 years. 2012 was a big old year for Main Street Vegan. And we're finishing up a class now, but we'll have another one this fall. So you can check that out at mainstreetvegan.net/academy. We have some 560 graduates in 33 countries on 6 continents, doing a lot of good in the world. So do check that out. And a newer project that I'm part of is the Compassion Consortium, and that is compassionconsortium.org. And this is an interfaith, interspiritual, interspecies center for people who feel that they want their soul to be nurtured in a way that understands their concern for all creatures and all beings. So we meet on the 4th Sunday of every month. So in February, that's going to be the 27th, 4 p.m. Eastern time. And we do all sorts of just wonderful things that you expect from a worship celebration. We've got music and prayer and meditation and all kinds of cool stuff. And our very special guest on February 27th is Dr. Milton Mills. So do check that out. Absolutely free, of course, but you do need to register to get the Zoom link. Now, let us get back to the heart of the matter with our wonderful guest, Dr. Baxter Montgomery. I said that you can find him at MontgomeryHeart.com. You can also find him on Facebook, Montgomery HW, that stands for Heart and Wellness, and on Instagram, Montgomery Wellness. So you were talking earlier, Dr. Montgomery, about inflammation, and we just hear that all the time. And I think we're like, yeah, okay, what do we do? What's wrong with it? And what do we do to have less of it?
So inflammation is part of it's a description of the global aspects of a set of chemical reactions, if you will, that typically is triggered through the immune system. So for instance, if you have an infection, which is one way of triggering the immune system. A foreign agent enters, a bacterium, a virus, and your immune system is alerted. And then certain immune cells address that. There's a direct cellular attack of the agent. And then these immune cells will then send chemical signals for other immune system cells to then come and carry out different functions. Part of this cascade of chemical signals result in the development of blood clots potentially. Say, for instance, if there's a blood vessel that's damaged, a certain type of chemical reaction may occur. Certain cells may be invaded by this infectious agent, so some cells are killed. So there's an attack against self to a certain extent. So there's a cascade of events or chemical reactions that are triggered by immune cells. And this could be triggered through an infection. It could be triggered through damage to a blood vessel or a break in the skin. So for instance, if you have a cut, then that results in damage in microvasculature as well as other tissue damage. Also, you may have invasion of foreign entities, bacteria that lives on the skin that shouldn't be inside the blood vessels. So that will trigger a cascade of events. So inflammation is sort of the outward manifestation of typically what's an immune system reaction. Now, this immune system reaction can be triggered by a lot of things. And we have what's called autoimmune diseases, where the immune system is falsely triggered by falsely identified self tissue as foreign. And so autoimmune, the immune system attacking self, hence autoimmune, is another mechanism to that. Now, there are different ways we get autoimmune diseases, but anything that can trigger inflammation can cause, anything that can trigger the immune system can trigger this global inflammatory response, which is, again, global description of a set of chemical reactions that are released by the immune system. So for instance, if someone consumes meat, there are certain molecules on the meat that triggers inflammation. And so you can trigger inflammatory reactions that way. If you cook meat, which most of the time people eat cooked meat, again, there's certain changes in the biochemistry of the meat that triggers these chemical reactions. And so inflammation is that global description of this biochemical response, usually that's triggered by the immune system. And so oftentimes people live with a low level or maybe medium level of inflammation in their body. This may be due to autoimmune disease, where their immune system is constantly revved up. It could be due to foods that they're consuming, where the immune system is constantly revved up. It could be due to maybe other things they're ingesting, whether it's medications or other molecules that they're ingesting through their environment. Maybe they're breathing certain things in. Allergens that come into the lung can trigger immune system reactions in the lung, trigger inflammation there. Wear and tear. Structural damage to the knees or the joints can then trigger long-term inflammation in those areas. So inflammation is kind of this global description that tends to be related to cascade of biochemical reactions, usually triggered by the immune system or some part of the immune system.
So help us understand, just for a layperson, when we think about typical heart disease, the coronary vascular kind, we think it's clogged up, some fat causes something to go on in the artery itself or in the endothelial cells that's going to cause trouble. And so where does the inflammation come in?
That's a great question. So the simple way of understanding is that when you have an artery, a normal vascular structure, it has an inner lining called the endothelium. These endothelial cells are very important in terms of determining vascular flow. They determine the ability of the blood vessels to dilate, constrict. Our blood vessels, we think of them as pipes, and that's a reasonable analogy because they allow flow throughout the body. However, they're much more complex than pipes. So for instance, our blood vessels are able to constrict and dilate based on the needs of that organ. For example, if you're eating, the blood vessels to the GI tract may dilate, and you may have blood vessels in other areas constrict. let's say you're in a car accident and you start to bleed out and your blood pressure drops, your blood vessels in the GI tract and the kidneys may constrict and may stay dilated for the brain and the heart because those areas are more important. So your body knows through this vascular system to preferentially shunt blood to one area or the other. So I say that to say that your vascular structure is very complex in this manner. So the endothelial cells play an important role there, and that's the inner lining of the blood vessels. In the middle part, you have smooth muscles, and of course, there are nerves that run throughout there. And of course, on the outside is thought best to think of as connective tissue that kind of protects the vascular structure. So this vascular structure is really important. It's a dynamic structure, and when it's in its normal fashion, it can constrict and dilate appropriately based on the body's needs. So in the heart, when it sends blood to the heart muscle, which is unique to heart muscle than other tissues, the heart muscle tissue extracts about 95% of the oxygen that's delivered to it. So when blood flows through the arterial aspect of the heart into the muscle, 95% of the oxygen is extracted. So when it returns on the venous side, it's very dark compared to in the other parts of the body, say your leg or whatever, typically extracts about 75%. And so if you develop some, increased need of oxygen in the leg, the leg muscle is going to extract just a higher percentage of blood. In the heart, it's different because the heart is always extracting nearly maximum amount of oxygen. So the only way to get more flow to more oxygen to the heart muscle is to get more flow. So that's one factor that's important. But in terms of dealing with what happens in the arteries and plaque, a simple aspect of it is that if you build up too much fat in the blood, too much cholesterol, the cholesterol gets deposited in certain areas. This cholesterol is carried by certain molecules, proteins. There's small LDL proteins, a lot of different types of proteins. Small LDL proteins are one type that we consider atherogenic. So for example, if you have a lot of cholesterol molecules carried in these small proteins, they then tend to deposit within vascular walls and build up more plaque. Plaque then brings in inflammatory cells, because oftentimes inflammatory cells are also carrying these cholesterol molecules. So you get inflammatory cells that are building up in this plaque as well. So then that's where you start to get inflammation, because you have an abnormal structure forming inside the vascular wall. And as that structure starts to develop, you can develop an instability. The more inflammatory cells that are inside that plaque, the more likely that plaque is to develop and rupture. And when the plaque ruptures, exposes the blood flow to underlying inflammatory cells and chemicals that then forms clot formation, et cetera. Because if you have the lining of the wall of the vasculature rupture, that's a signal to the body that I have a damaged blood vessel. And true, the blood vessel is damaged, but it's not damaged in the way that the body is designed to correct damage. So for instance, if you have a cut in your leg and you have a major severance of a large blood vessel, the body is designed to send a clot, form a clot at that damaged area to shut off bleeding. However, if you have a plaque inside the artery, then the plaque ruptures. If you form a clot, it shuts off flow. That artery is not severed, so you're not bleeding out of the artery. What happens is that when you rupture a plaque on the inner side of the lining, it's a signal to the body that, hey, this is a damaged vessel, and the body does what it's supposed to do. It sends chemicals over to form clot, but if it forms clot in that area, that clot obstructs flow to part of the heart, and there you have a heart attack. So what you're having is with plaque formation, it's an abnormal formation or process in the inner lining of the wall, and it sets you up for rupture on the inner lining of the wall, which then gives a inappropriate signal to the body to form a clot at a place where you don't want a clot to form.
So when somebody is looking at all of this and trying to live like a heart healthy life, what do we do? Where do we start? If I suppose seeing a cardiologist if we're a certain age is probably a good idea, but the lifestyle, what does it look like overall?
So the simple things you can do is you want to live a lifestyle that's anti-inflammatory. So you want to decrease inflammation and decrease really decrease abnormal things coming to your body. So if I simplify it for anybody, if you want to optimize your health, you want to minimize the amount of invasion that gets into your body. Invasion with abnormal food that's not intended or ideal for consumption. Bad air, whether that bad air is coming from the tip of a cigarette or smog in the area or a poorly ventilated room. You want to try to just minimize abnormal things in your body. And if you go even broader, bad thoughts and things like that can also trigger inflammation. But keeping it simple and physiologic and related to food, optimal nutrition is a plant-based diet, but it has to be a healthy plant-based diet. So that means there's going to be minimally processed. And we describe our regimen as minimally processed, whole food, plant-based. So the minimally processed part, even though it may not all be raw, you want to eat a large percentage of the food that's not heated above, say, 130 degrees. And the food that's heated above 130 degrees, you want it steamed or boiled. I don't recommend microwaving, frying in oil, or sauteing in oil, or microwaving, or grilling at high temperatures in oil. So we recommend if you're steaming, boiling, I think is okay, but you want to eat a high percentage of food that's minimally processed, that's either completely raw or not warmed above 130 degrees. You want to drink water. We recommend alkaline water. Personally, I drink a water that's from 2 miles deep. But if you drink a good alkaline water, I think you're okay. There's some of my colleagues in this space who recommend distilled water. And the argument there is that virtually all the water has contaminants in it. So you want to, maybe even go to the extreme of testing your water or things like that. But getting a good, either distilled water where you maybe add greens to it to add electrolytes is good. And exercise, believe it or not, aerobic exercise is excellent. Anaerobic exercise mixed with aerobic exercise can be good. High intensity exercise. These things are beneficial. They improve mitochondrial function. They also, through sweating, help you remove toxins from the body. In infrared sauna therapy, we use that with a lot of our patients. It has an anti-inflammatory effect. Infrared sauna therapy allows for the removal of toxin, but it also can have an exercise effect. Having been in the sauna for as little as 10, 15 minutes, there's data in Japan and Finland showing patients with cardiovascular disease do very well with infrared sauna therapy. It reduces the resistance of flow, so improves circulation. Heart failure patients get better. Patients with arthritis get better, so it's an anti-inflammatory component. So these are some basic things that you can do. High raw, plant-based diet, minimally processed, whole food, plant-based diet, fresh air, sunshine, exercise, keep your vitamin D levels up. If you live in a northern climate with little sunshine, you're going to supplement vitamin D. In the US, we have vitamin D levels range from 30 to 100 nanograms per ml. Being normal, we recommend at least above 50, preferably 75 or 80 nanograms per ml levels for our patients. And so these are the things that we think that are beneficial from the standpoint of decreasing inflammation, improving overall cardiovascular health. And if you have a diagnosed condition, so if you have advanced heart disease, then I would recommend the diet being virtually all raw, because that's going to give you a better chance of reversing things, at least all raw for a certain extended period of time. That's what we recommend for our patients. And infrared sauna is very beneficial for people with advanced heart disease.
Wow. And it just sounds like such a beautiful way to live. It sounds like if you're 20 years old and as healthy as could be, it would just be a great way to live. Or, you could
Yes.
be 85 and dealing with stuff, and it's a great way too. So you mentioned not heating oils and cooking. What about oil in general? There seems to be so much controversy because there does seem to be some good stuff from the Mediterranean diet. And then, in other quarters, oil is the worst thing ever. I think people are confused.
Yeah.
Where do you come down on that?
The simple argument is this. We don't recommend oils. The exception would be in vitamin D supplements, and there may be a few other rare supplements that are oil-based. And so because people have to supplement vitamin D because we're indoors and we're not getting adequate sunshine, we allow oil in that situation. So I guess you can argue there's some arguments in favor of oil, particularly with the vitamin D supplements and maybe other supplements as well. But the overall argument against oil that I make for my patients is the following. If you take the purest oil, first cold press, et cetera, olive oil, whatever you want to, describe, one, you cannot be certain of the purity of the extraction. So was it heat extraction, was it chemical extraction, et cetera. Even though they label it first cold pressed, I'm not sure how well the labeling is regulated. But let's go beyond that. Let's say it's first cold pressed. Then you get to the point of storage. Again, once it's out of the olive, the clock starts ticking. And what's the stability of the oil? Now, if you're pressing it from the olive to your tongue, okay, that's good. But you may as well just eat the olive. And so when you get to olive oil or any oil, there's shelf stability, it becomes rancid, it breaks down, and so on and so forth. And so there's a problem there that I see. So even if you're not cooking the oil may have already been heated, it gets subjected to air, it gets subject to oxidation. And so it can, and unlike say other processed molecules, it may be the most lethal. Certain processed sugars may be as lethal or more lethal, but certainly extracted oils are very, very problematic.
Okay, got it. And I love how you explain that. Thank you. So your center there in Houston, where you help so many people, it's the Montgomery Heart and Wellness Health Center. So you do things other than just heart disease. And because we've talked, and my listeners know if they've been listening the past week or two, that my husband is in the hospital and he had surgery and he has a large wound. And you were talking with me a little bit before the show, what you would do with a patient like that. That's pretty far from the heart. What would somebody do who's trying to recover? Or you even talked about somebody who's looking to go into surgery, or just all these different things that some of these protocols can help.
Yeah. So, and as you mentioned, your husband has some issues with infection and the like. Again, you want to reduce oxidative stress because the potential risk of inflammation anywhere is the potentiation of inflammation everywhere. But if you have inflammation at one location, the body's working against that. So what you want to do is you want to reduce oxidative stress and reduce inflammation. Oxidative stress is just, I like to describe it as an imbalance of excess chemicals, such as free radicals, compared to antioxidants. So, free radicals come from different sources. Our own body's immune system is a source of free radicals. They use free radicals to attack foreign agents such as infection. So the immune system will use free radicals, think of them like bullets that find free radicals toward, microbes that need to be killed, or cells that are invaded by microbes that need to be killed. So free radicals play a beneficial role, but they need to be kept in check. What happens is someone who has increased free radicals, if the free radicals become unbalanced, so you have excess free radicals compared to antioxidants, you then have oxidative stress. So these free radicals roam around, they damage normal tissue, normal cells, normal DNA, and the like. So you can get to a point where you have other organ dysfunction. So somebody with an infection can have kidney dysfunction, they have infection, have liver dysfunction. Now, these organ dysfunctions may not be so severe that it shows up on the blood test, but at the biochemical level, the body's not functioning optimally. If the liver is partly impaired by excess oxidative stress, that in turn impairs your immune system, because the immune system, helps is in part supported by the liver, large part. Vitamin D, the initial oxidation of vitamin D is by the liver. If kidney function is impaired, then secondary oxidation of vitamin D is impaired. Vitamin D plays an important role in the immune system. Antibody formation in the liver, other protein formation in the liver. If you're trying to heal tissue, your liver is your manufacturer for most proteins, enzymes, and the like. Your coagulation system is supported by the liver. So increased oxidative stress can potentiate organ dysfunction. Organ dysfunction potentiates abnormal body function. Abnormal body function delays healing. So what do? raw fruits and vegetables only. And someone who's sick enough to be in the hospital, an infection, inflammatory condition, I put them on raw fruits and vegetables only. That's green smoothies without the super fruits, maybe an apple mixed with other greens. I may do lots of super green powders, blue-green algae, spirulina powders or the like. They have salads, wraps, gourmet raw foods to make it satisfying. But I wouldn't use any cooked foods. You mentioned Beyond Burger when we were talking. I wouldn't use Beyond Burger, not to be negative about a certain brand. But there's certain plant foods that are, in my opinion, as bad as animal protein. If you're eating, processed plant foods of certain types, you may as well be eating a cheeseburger to a certain extent. So when someone who's acutely ill or almost acutely ill or getting ready to go through surgery, which could, put you at risk for being acutely ill, that's when we really emphasize a raw plant-based diet, 100%.
This is so exciting to me, Dr. Montgomery, because you're talking about what can really help people who need it right now in an acute situation, but you're also suggesting just a beautiful, uplifting, enlightening way of life for everybody on earth. I hope everybody hears you. Listeners, montgomeryheart.com. Find the good doctor on Instagram, Montgomery Wellness. And we'll have him back just as soon as he can find the time. Thank you so very much. This has been wonderful. To everybody listening, thank you so much for spending this hour with us. God bless you. Eat your veggies, mostly raw. Take care, everybody. See you next time.